Autoimmunity basically means immunity to self, a condition that occurs when the immune system mistakenly attacks and destroys healthy body tissue. And autoimmune diseases are diseases that arise from an overactive immune response of the body against substances and tissues normally present in the body. The immune system mistakes some part of the body as a pathogen and attacks it. This may be restricted to certain organs or involve a particular tissue in different places. The treatment of autoimmune diseases is typically with immunosuppression, that is, a medication which decreases the immune response. The symptoms of autoimmune diseases vary depending on the disease as well as the person's immune system. Common symptoms include anxiety or depression, blood sugar changes, digestive or gastrointestinal problems, dizziness, elevated fever and high body temperature, extreme sensitivity to cold in the hands and feet, fatigue, infertility, inflammation, irritability. Along with that, there is low or high blood pressure, malaise, weakness and stiffness in muscles and joints, weight changes, and depending on the type of autoimmune disease, there is destruction of an organ or tissue, or there is increase in the size of an organ or tissue. Autoimmune diseases almost affect every parts of the body, including brain, eyes, mouth, lung, stomach, joints, liver, kidney, uterus, etc. Autoimmune diseases are a group of disorders in which tissue injury is caused by humoral, that is by autoantibodies, or cell-mediated immune response, that is by autoreactive T cells to self-antigens. Normally, the immune system does not attack the cell. However, there is a large group of autoimmune diseases in which the immune system does attack cells. The attack can be directed either against a very specific tissue or to a large number of tissues. Once started, autoimmune diseases are hard to stop. Let's see some of the general principles and observation about autoimmunity. Autoimmunity results from a failure or breakdown of the mechanisms normally responsible for manipulating self-tolerance in B cells, T cells, or the both. The major factors that contribute to the development of autoimmunity are genetic susceptibility and environmental triggers such as infections. Autoimmune diseases may be either systemic or organ-specific. Various effector mechanisms are responsible for tissue injury in different autoimmune diseases. Epitope spreading is also observed, that is, autoimmune reactions initiated against one self-antigens that injure tissues may result in the release and alteration of other tissue antigens, activation of lymphocytes specific for these other antigens, and exacerbation of the disease. Autoimmunity results from a failure of the mechanisms of self-tolerance in T or B cells, which may lead to an imbalance between lymphocyte activation and control mechanisms. Some of the general causes that are associated with autoimmune reactions are: the first one is the defects in deletion of T or B cells or receptor editing in B cells during the maturation of these cells in the generative lymphoid organs. Second one is the defective numbers and functions of regulatory T lymphocytes. Then there is defective apoptosis or cell death of mature self-reactive lymphocytes. Then there is inadequate function of inhibitory receptors. Then activation of antigen presenting cells, which overcomes regulatory mechanisms and results in excessive T cell activation. Now let's see some of the mechanism for induction of autoimmunity. The first one is the release of sequestered antigen, molecular mimicry, inappropriate MHC2 expression, polyclonal activation of B cells. Now let's see about the release of sequestered antigen. Sequestered antigen means the antigen which are isolated or hidden. The induction of self-tolerance in T cells results from the exposure of immature thymocytes to self-antigen and the subsequent clonal deletion of those that are self-reactive. Any tissue antigens that are sequestered from the circulation and are therefore not seen by the developing T cells in the thymus will not induce self-tolerance. Exposure of mature T cells to such normally sequestered antigens at a later time might result in their activation. For example, myelin basic protein is an example of an antigen normally sequestered from the immune system, in this case by the blood-brain barrier. Another example is the sperm, which arise late in development and are sequestered from the circulation. However, after a vasectomy, some sperm antigens are released into the circulation and can induce autoantibody formation in some men. Similarly, the release of lens protein after eye damage or of heart muscle antigens after myocardial infarction has been shown to lead on occasion to the formation of autoantibodies. The second one is the molecular mimicry or cross-reacting antigens. According to this hypothesis, self-antigens are mimicked by some non-self antigens, especially those of the viral and bacterial origin. A number of viruses and bacteria have been shown to possess antigenic determinant identical or similar to normal host cell components. Hence, the autoantibody formation induced by such molecules lead to autoimmunity. Examples of these reactions include antibodies to streptococcal antigen cross-react with some heart muscle antigens and cause rheumatic fever. Just like that, antigen of human brain and antigen of sheep brain, streptococcal M protein and heart muscles, nephritogenic strains of streptococcal antigens and renal glomeruli share similar epitopes, and all these results in cross-reaction. The third mechanism is by the inappropriate expression of class II MHC molecules. They are normally expressed only on antigen-presenting cells. The inappropriate expression of MHC2 on other cells may serve to sensitize T helper cells to peptides derived from these cells, allowing activation of B cells or T cytotoxic cells or sensitization of Th1 cells against self-antigens. For example, the pancreatic beta cells of individuals with insulin-dependent diabetes mellitus express high levels of both class I and class II MHC molecules, whereas in the case of healthy beta cells, they express lower levels of class I and they do not express class II at all. Fourth mechanism of autoimmunity is by polyclonal activation of B cells. A number of viruses and bacteria can induce non-specific polyclonal B cell activation. Gram-negative bacteria, cytomegalovirus, and Epstein-Barr virus, that is EBV, are all known to be such polyclonal activators, inducing the proliferation of numerous clones of B cells that express IgM in the absence of T helper cells. If B cells reactive to self-antigens are activated by this mechanism, autoantibodies can appear. For example, during infectious mononucleosis, which is caused by EBV, a variety of autoantibodies are produced, including autoantibodies reactive to T and B cells, rheumatoid factors, and anti-nuclear antibodies. Some autoimmune diseases may have a genetic component and they are triggered by external factors such as infection or injury. Others are probably strictly caused by external factors like infection or injury alone. In this session, we are going to see the major classification of autoimmune diseases. They are classified into three groups. The first one is hemolytic autoimmune diseases. Second one is localized autoimmune diseases. And third one is systemic autoimmune diseases. The first category, that is hemolytic autoimmune diseases. These are the clinical disorder due to destruction of blood components. Autoantibodies are formed against one's own RBCs, platelets or leukocytes. Examples of such diseases include hemolytic anemia, leukopenia, thrombocytopenia. The second category is the localized autoimmune diseases or organ-specific autoimmune diseases. A particular organ is affected due to autoantibodies, and the examples of these autoimmune diseases include thyroiditis, which attacks the thyroid, multiple sclerosis, which attacks myelin coating of nerve axons, myasthenia gravis, attack nerve muscle junction, juvenile diabetes or type 1 diabetes mellitus, which attacks insulin producing cells. The third group is the systemic autoimmune disease or non-organ specific autoimmune diseases. The immune complexes accumulate in many tissues and cause inflammation and damage. It affects many organs or the whole body. For example, systemic lupus erythematosus. Here anti-nuclear antibodies are formed and it harms kidney, heart, brain, lungs, skin, etc. Another one is the rheumatoid arthritis. Here anti-IgG. Another one is the rheumatoid arthritis. Here anti-IgG antibodies are formed and it affects joint, heart, lung, nervous system. In rheumatic fever, there is cross reaction between antibodies to streptococcus and autoantibodies. Let's see each of the disease in detail. The first one is autoimmune hemolytic anemia. Lysis of RBC is due to the production of autoantibodies against the RBC antigens. For normal RBC, the half-life is 21 days, but in the case of hemolytic anemia, it's less than 7 days. It is caused as a result of secondary infections or during drug therapy. For example, penicillin, antihypertensive agent like methyl dopa result in destruction of RBCs. These are antibody-mediated autoimmune diseases. Two classes of autoantibodies are involved. IgM or cold agglutinins, which is activated at 4 degrees Celsius but not at 37 degrees Celsius. IgG or warm agglutinins, which is activated at 37 degrees Celsius but not at 4 degrees Celsius. The next disease under hemocytolytic autoimmune disease is thrombocytopenia. It is characterized by low platelet count due to the production of antiplatelet antibody, which is of IgG type. An interaction of antibody with bound drug or new antigen causes intravascular agglutination of platelets and can be eliminated by phagocytic cells. This is also an antibody-mediated autoimmune disease. Another one is the Hashimoto's thyroiditis. It comes under localized or organ-specific autoimmune disease. Hashimoto's thyroiditis is otherwise known as lymphadenous goiter. Atrophy of thyroid gland, which results in hypothyroidism and destruction of thyroid function, take place in this. It is characterized by goiter, enlarged thyroid gland, deficiency of thyroxine, and it is characterized by type 4 hypersensitive reaction. It is caused by autoantibody of IgG and IgM type against the constituents of thyroid gland, that includes thyroid epithelial cells, colloid and nuclear components. It is a T-cell associated autoimmune disease. We can see the enlarged, inflamed, hyperfunctioning thyroid. And it was the first disease that is recognized as an autoimmune disease and was discovered by Dr. Hashimoto Hikaru. The next disease coming under localized organ-specific autoimmune disease is the thyrotoxicosis or the Graves' disease. The antibody is IgG type and is directed against the receptor for thyroid stimulating hormone, that is TSH. This antibody is called as long-acting thyroid stimulator, that is LATS, or thyroid stimulating antibody. The primary causes of this disease include the stimulation of thyroid gland to secrete more thyroxine, that is hyperthyroidism, resulting in exophthalmos, bulging eyes and goiter. In Graves' disease, the antibodies do not destroy the thyroid but act as if they are thyroid stimulating hormone, that is, they bind and activate the TSH receptor. Next one is the Addison's disease. It is due to adrenocortical damage and hence insufficient secretion of adrenal hormones result. Tissue damage is caused by autoantibody against zona glomerulosa cells of adrenal cortex. Myasthenia gravis. It is caused by autoantibody against muscle antigen and acetylcholine receptor antigen. It is characterized by increased muscular weakness that make one fatigue. Speaking, eating and walking become tiresome. Eventually, death occurs from respiratory failure. Acetylcholine cannot be produced, thus nerve impulse cannot be transmitted from the nerves to the muscles. Hence, the neuromuscular junction is severely affected. The disease is marked by progressive weakness and loss of muscle control. It is classified as a B-cell disease. Autoantibodies are formed against nicotinic acetylcholine receptors. There is an autoimmune anemia termed pernicious anemia. It is caused by the deficiency in vitamin B12, and autoantibodies to the intrinsic factor causes this. That is, autoantibody is directed against the intrinsic factor and prevents the absorption of vitamin B12 as it blocks its attachment to the gastric intrinsic factor and interferes with its uptake by the intestinal mucosa, and the B12 remains in the stomach and it is excreted. The pernicious anemia can be treated with injections of B12. The next category is the systemic autoimmune diseases. In this type, the immune response is not directed to a target antigen unique to a single organ or gland. Rather, it is directed to any different organs, tissues and cells of the body. For example, systemic lupus erythematosus. Systemic lupus erythematosus is a systemic autoimmune disease that can affect any part of the body. Affected individuals produce autoantibodies to a vast array of tissue antigens such as DNA, histones, RBCs, platelets, leukocytes, often through the excessive complement activation. The treatment of systemic lupus erythematosus involves preventing flares and reducing their severity and duration when they occur, and treatment can include corticosteroids and anti-malarial drugs. It is a skin disease due to the production of anti-nuclear factor, that is ANF, or anti-nuclear autoantibody. Anti-nuclear factor react with the breakdown products of nuclei in the normal wear and tear of cells and form immune complexes which cause the tissue damage. In these patients, lupus erythematosus, which is a mature neutrophil, appears in blood and bone marrow. And the function of this is to phagocytosis. Characteristics of systemic lupus erythematosus. There is appearance of blood red spots over the bridge of nose and cheeks. The lesion take the shape of a butterfly. Connective tissue of the skin, kidney, heart, spleen and blood vessels are severely damaged, resulting in joint pain, fever and anemia. Glomerulonephritis due to the deposition of immune complex occurs in the glomerulus region. It is a systemic disease affecting the whole body. You can see the image of a baby suffering from SL, and this image shows the butterfly kind rashes. Clinical manifestation of systemic lupus erythematosus include musculoskeletal, that include joint and muscle pain, dermatological, there is mole rash, renal system affected by glomerulonephritis, and also female to male ratio is found to be 9:1. That means females are more affected by this disease. Genetics, race, hormones, environment, all these factors are triggering factor for this disease. Next one is the rheumatoid arthritis. It also comes under the systemic or non-organ specific autoimmune disease. It is a chronic systemic disease of the joints and is caused by the autoantibody of IgM type and called as rheumatoid factors. The synovial fluid of these patients contain increased number of T cells and macrophages. It's marked by inflammatory changes in the synovial membrane and by atrophy of bones. In later stage, deformity and ankylosis develops. The joints are swollen and edematous. Another example of the systemic autoimmune disease is the Sjogren syndrome. It is a triad of conjunctivitis sicca, dryness of the mouth, with or without salivary gland enlargement, and rheumatoid arthritis. This syndrome may occur in association with other collagen diseases. Gender differences in autoimmunity. Women are more susceptible to autoimmune diseases than men. This is because it has been deduced that women produce higher titer of antibodies than men and so, in general, more vigorous immune responses. Women generally tend to have higher levels of CD4 plus T cells and significantly higher levels of serum IgG. Diagnosis of autoimmune diseases. It is diagnosed by clinical symptoms and confirmed by detecting the autoantibody in the serum of the patients. Autoantibodies are demonstrated by immunofluorescent antibody test, hemagglutination, complement fixation, immunodiffusion, radioimmunoassay. Some autoimmune diseases are treated with medications that alleviate specific symptoms. For hemolytic anemia, it is treated with vitamin B12. Thyrotoxicosis treated with anti-thyroid drugs. Myasthenia gravis treated with choline esterase inhibitors. Rheumatoid arthritis treated with anti-inflammatory drugs. Lupus erythematosus treated with immunosuppressive or anti-mitotic drugs such as corticosteroid, cyclophosphamide, azathioprine. Current therapies for autoimmune diseases include immunosuppressive drugs, thymectomy, plasmapheresis, vaccination with T cells specific for an autoantigen, usage of synthetic blocking peptides, and usage of monoclonal antibodies. Immunosuppressive drugs include corticosteroids, azathioprine, and it slows the proliferation of lymphocytes. Cyclosporin A blocks signal translation mediated by the T cell receptor. In thymectomy, there is removal of thymus from patients with myasthenia gravis. Plasmapheresis is a removal of antigen-antibody complexes for a short-term reduction in symptoms. Now let's see the overall summary of autoimmune diseases. Autoimmune diseases and conditions exist when the body produces abnormal cells which attack the body itself. Most autoimmune diseases strike women more often than men. The causes of autoimmune diseases are not known, but some autoimmune diseases seem to run in families. It can strike any part of the body, symptoms vary widely, and diagnosis and treatment are often difficult. Medical science is striving to design therapies that prevent autoimmune diseases.